Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good afternoon. I've reviewed your file, but I'd like to hear from you about how you've been feeling lately, especially with your breathing and sleep.
Thanks, Doctor. Well, it's been tough. I've been using the mometasone and formoterol as you suggested. They help a bit with the breathing during the day, but at night it's a different story. I still feel like I can't catch my breath, and I'm waking up several times. I'm on oxygen at night, but it doesn't seem to make enough of a difference.
I see. You mentioned having difficulty sleeping. Can you describe what happens when you try to sleep?
Sure. Even with the oxygen, I find myself waking up gasping for air. I'm barely getting 4 hours of sleep a night. It's really hard to function during the day. I'm tired all the time.
That sounds very challenging. You also mentioned a dry mouth. Has there been any improvement since stopping the tiotropium?
No, not really. The dry mouth is still a problem. I've tried drinking more water before bed, but then I'm up all night going to the bathroom, which doesn't help with my sleep either.
There's also the issue with my chest pains. They come and go, even when I'm just sitting and reading. I take an aspirin when it happens, but it's been worrying me a lot.
Understood. We'll definitely look into that. How about your general activities during the day? How are you managing with your daily tasks?
It's getting harder. I don't have the energy I used to. Simple things like walking up the stairs or going for a short walk are much more difficult now.
Thank you for sharing that. Let's discuss your past medical history a bit. You mentioned a lump that was removed. Can you tell me more about that?
Oh, that was a few years back. They found a small lump on my back. The doctors removed it and said it wasn't cancerous. I haven't had any issues with it since.
Good to know. And your prostate issues, how have they been since you started the finasteride?
The medication helps a bit, but I still have some urinary symptoms, frequent urges, a bit of a struggle to get going. That's why we're looking into my kidney function, right?
Exactly. We want to make sure there's nothing more serious underlying these symptoms. Now, about your upcoming tests. We have a CAT scan and a stress test scheduled. Are you feeling prepared for those?
I guess I'm ready. I just want to find out what's wrong and hopefully start feeling better. It's been a long road with these health issues.
I understand. It's our goal to get you feeling better. Based on what you've told me and the tests we have planned, we'll have a clearer picture of how to proceed. Here are the details from your recent tests and the plan moving forward. Your blood pressure and other vitals are stable for now, which is good. The labs show normal kidney function with a creatinine of 1.2 milligrams per dL and BUN at 18 milligrams per dL. Your electrolytes like sodium and potassium are also within normal range. Your chest X-ray didn't show any new issues beyond the known emphysema. The pulmonary function tests suggest moderate obstruction. The upcoming CAT scan will help us look at your kidneys more closely, and the stress test will assess your heart given your chest pain episodes. For now, continue using your inhalers as prescribed. We should also consider adjusting your sleep setup to help with the nighttime breathing issues, possibly adding a different type of pillow or mattress that could help keep your airways more open. After we get the results from the upcoming tests, we'll meet again to review and update your treatment plan. It's important that we tackle both your respiratory issues and your sleep problems comprehensively.
Thank you, Doctor. It's reassuring to know we have a plan. I appreciate you taking the time to go through everything with me today.
Of course, it's important that you feel informed and involved in your care. We'll see each other after your tests, and in the meantime, don't hesitate to contact us if you have any more questions or concerns.
Will do. Thanks again, Dr. Reynolds. See you after the tests.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
I came in because I've been struggling with my blood sugar levels. Despite being on insulin now, they're still not where we want them. I've been trying to adjust to the insulin, but it's been tough. I remember when I was just on the pills, my sugars would sometimes hit the 400s. It was scary.
It's good that you've started on insulin, as it can be more effective for some people. It's also good to hear that you're monitoring your levels closely. Can you tell me how you've been adjusting the doses?
Well, I started with 15 units at night, as we discussed. I've been checking my sugars, and they're better, but still higher than we'd like in the morning. I know you mentioned possibly going up to 20 units, but I'm worried about going too low overnight.
That's a valid concern. We want to avoid any severe lows. How about your diet and exercise? Any changes there?
I've been trying to walk more, maybe 3 times a week. As for eating, I've cut back on carbs and sugars, which has helped a bit.
Good. Exercise and diet can significantly impact your glucose control. Let's talk about your vision. You mentioned it's still blurry?
Yes, and it hasn't gotten much better, even with the sugar more controlled. I haven't seen an optician since 2011, which I guess isn't helping.
Seeing an optician soon would be wise, especially to rule out any diabetes-related complications like retinopathy. How about your sinuses? You mentioned ongoing issues there too.
It's been rough, especially with the congestion. I've cut down on smoking, which helps a bit. Last time, a nasal spray was prescribed, and it worked well. I think it was flunizolide.
Right, nasal sprays can be effective for sinusitis, especially to reduce inflammation. We can start you on that again. Now tell me more about your pain management.
My neck and hip pain varies a lot. Sometimes it's bearable, other times not so much. I've been using Vicodin, but I try not to take it too much. I'm worried about getting dependent on it.
That's a legitimate concern, especially with opioids like Vicodin. We need to manage your pain, but also consider the long-term effects of such medications. How has your thyroid been? Any symptoms like weight changes or energy levels?
Not really. No major symptoms. I know the goiter was found during a checkup, but I haven't had any issues that I've noticed.
Okay, we'll keep an eye on that, especially with your upcoming endocrinology appointment. Let's review your lab results from today and outline a plan.
Sure, I appreciate that.
Your hemoglobin A1C is at 9.2%, which is quite high. This confirms that your glucose levels have been consistently elevated over the past few months. Your blood pressure is slightly high at 142/88 mm/Hg, and your BMI at 28.3 indicates you are overweight, which can impact your diabetes control. Your lipid profile shows your LDL cholesterol at 130 mg/Dl, which is high and could increase your risk of heart disease. Your renal function tests show a creatinine of 1.4 mg/dl and an eGFR of 55 mg/1.73 that are indicating some kidney impairment, likely due to diabetes.
That sounds concerning. What should we do next?
Firstly, I'd recommend increasing your insulin glargine to 20 units at night. We'll monitor this closely to ensure you don't go too low. I'll also arrange for a pharmacy consultation for you to have regular medication reviews. For your vision, I'd like you to see an optician as soon as possible. We'll restart the nasal steroid spray for your sinuses. Regarding your thyroid, the endocrinology consultation will help us decide if further investigation is needed. As for your pain, we need to look into alternative pain management strategies that reduce your reliance on Vicodin.
Okay, that sounds comprehensive. I hope these changes will help.
I believe they will. We'll also schedule a follow-up call to discuss your blood glucose management and see how you're adapting to the increased insulin dose. Please keep track of your blood glucose levels and any hypoglycemic episodes.
Will do. Thank you for going through everything with me. It's a lot, but I'm glad we have a plan moving forward.
Of course, managing health can be complex, especially with multiple conditions, but you're not alone in this. We'll adjust the plan as needed based on how you respond. It's important to keep communication open.
Absolutely. I'll keep you updated on everything.
Thank you. I look forward to hearing about your progress. Take care and see you soon for the follow-up.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
We need to address the gaps in our current community health resources, especially in underserved areas. A mobile clinic could be a practical solution to increase accessibility.
Absolutely, and focusing on preventive care through these mobile units can reduce emergency visits. Perhaps we could also integrate mental health services.
That's a good point. Mental health often lacks adequate resources. Mobile mental health services could provide counseling and crisis intervention right where it's needed.
I also think that community education sessions on nutrition, exercise, and chronic disease management could empower residents to take charge of their health.
Definitely. Partnering with local organizations to host these sessions could extend our reach, maybe even include screenings during these events.
Yes, regular screenings for blood pressure, diabetes, and cholesterol could catch issues early. We could compile a schedule and distribute it through community centers and schools.
Now look at question 26.
Managing your heart failure effectively involves several lifestyle adjustments. First, let's focus on your diet. Limiting fluid and sodium intake is crucial.
I've read about the fluid restriction. How much is safe for me to drink daily?
Ideally, you should not exceed 1.5 to 2 liters per day. This includes all beverages and even the water content in foods.
That seems tough. And what about exercise?
Moderate exercise is beneficial, but it has to be tailored to your current health status. Starting with activities like walking or stationary cycling is safe. Have you considered cardiac rehabilitation?
No, what does that involve?
It's a supervised program that includes exercise training, education on heart-healthy living, and counseling to reduce stress and help you return to an active life.
Now look at question 27.
Completing your antibiotic course is crucial for full recovery and to prevent antibiotic resistance. How are you feeling today with the medication?
A bit better, but still quite weak. Should I be doing anything else to help my recovery?
Rest is key, but you should also maintain good hydration and nutrition. Avoid close contact with others to reduce the spread of your illness.
Can I take anything for the fever?
Yes, over-the-counter fever reducers like acetaminophen can help. However, monitor your temperature, and if it doesn't improve or worsens, please consult your doctor.
Thanks for the advice. How do I know when I'm no longer contagious?
Generally, you'll be less contagious after 24 hours without a fever, and once your symptoms start improving significantly. However, follow your doctor's advice for your specific situation.
Now look at question 28.
Our approach needs to integrate psychosocial support as a core aspect of patient care, especially for those with chronic conditions.
Agreed. Many patients struggle not just physically, but also emotionally and socially. We should consider regular assessments of their psychological needs.
Perhaps we could implement a system where social workers or psychologists are part of the initial care team when a chronic condition is diagnosed.
That's a great idea. Regular follow-ups could help adjust their care plan as their psychosocial needs change. Also, support groups can provide a community feeling that many patients lack.
Exactly. Support groups moderated by professionals can help patients share experiences and coping strategies, reducing feelings of isolation.
We should also think about the families. Providing them with resources and support can make them more effective caregivers, which in turn helps the patient's overall well-being.
Now look at question 29.
Understanding contractions is crucial as your due date approaches. True labor contractions don't just come and go. They develop a regular pattern and gradually get closer together and more intense.
How can I be sure what I'm feeling are real labor contractions?
Real contractions last about 30 to 70 seconds and come at regular intervals, getting shorter over time. They also become stronger and more painful.
What should I do when I start having these contractions?
When they are about 5 minutes apart, lasting for a minute, and this pattern has been going on for at least an hour, it's time to head to the hospital.
Is there anything else I need to monitor?
Keep track of any other signs, like water breaking or any significant change in the baby's movements. If unsure, don't hesitate to call us.
Now look at question 30.
Recognizing early signs of mental illness can lead to earlier intervention and significantly better outcomes. Today, we'll discuss these signs and how you can help.
What are some common signs we should be aware of?
Changes in mood, behavior, or eating patterns are key signs. Withdrawal from social interaction, unexplained sadness or anger, and changes in sleep patterns are also important indicators.
How should we approach someone showing these signs?
Approach them with empathy and without judgment. Encourage them to talk about their feelings and suggest seeking professional help.
It's also beneficial to be informed about the resources available in your community. Knowing where to direct someone can make all the difference.
Is there a way to help without seeming intrusive?
Yes, often just being there, listening, and showing you care can be very supportive. Let them know you're there for them and ready to help whenever they're ready to seek it.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at extract 1.
Welcome to today's healthcare talk. I'm delighted to be joined by Dr. Megan Martin, a prominent nephrologist and advocate for equitable healthcare practices. Today, we delve into a significant topic that bridges nephrology, ethics, and healthcare policy, the reconsideration of race as a factor in medical equations, specifically in estimating glomerular filtration rate, or eGFR. Dr. Martin, could you start by explaining the historical context behind the inclusion of race in these equations?
Certainly, and thank you for having me. The use of race in medical equations like the eGFR began with intentions of increasing accuracy in clinical assessments. Historically, race was integrated into these equations based on data suggesting differences in biomarkers like creatinine levels across racial groups. The initial study that propelled this was the MDR-D study in 1999, which introduced race as a factor to purportedly refine the accuracy of kidney function estimations.
Interesting. Can you elaborate on why this approach is now considered problematic?
Absolutely. The main issue is that race is a social construct, not a biological determinant. The assumptions made about biological differences based on race have no robust genetic or scientific foundation. They inadvertently perpetuate racial stereotypes and could lead to disparities in treatment. For example, the higher muscle mass attributed to Black individuals, which was used to justify adjustments in eGFR calculations, lacks empirical support and reflects a broader issue of racial bias in medicine.
That's quite concerning. Could you provide a case study that illustrates the practical impact of these racial adjustments in medical practice?
Yes, let's consider the case of Mr. Thompson, a hypothetical patient but representative of real scenarios. Mr. Thompson, a Black man in his 50s, presented with symptoms indicative of chronic kidney disease. His eGFR, calculated using the traditional equation with a racial modifier, estimated his kidney function to be better than it actually was, delaying crucial interventions like being placed on the kidney transplant list. This delay stemmed from the inflated eGFR, which suggested less severe kidney impairment due to the racial correction factor.
So, what changes are being advocated to address these issues?
Recent guidelines, such as those from the National Kidney Foundation, have recommended removing race from eGFR equations. The new approach uses a race-neutral model, focusing on universal biological markers like creatinine and cystatin C, which do not vary significantly with the patient's race, but rather their actual physiological state.
This shift must have substantial implications for patient care. Could you touch on the potential benefits?
Certainly. By removing race from the equation, we provide a more accurate and equitable assessment of kidney function for all patients, irrespective of race. This change aims to eliminate the inherent biases and ensure that clinical decisions, from medication dosages to transplant eligibility, are based on more accurate health indicators. For patients like Mr. Thompson, it means receiving appropriate care faster, without the distortions introduced by racial assumptions.
Looking forward, how can the medical community further address racial biases in healthcare?
Education is key. Medical professionals must be trained to recognize and challenge the historical biases that permeate clinical tools and practices. Moreover, ongoing research should aim to refine diagnostic and treatment approaches based on physiological data rather than social constructs of race. Engaging with diverse patient populations to understand their unique health experiences is also crucial in shaping inclusive health policies.
Dr. Martin, thank you for shedding light on this critical and complex issue. Your insights are invaluable in guiding us towards a more just and effective healthcare system.
Thank you for the opportunity to discuss this important matter. It's essential that we continue these conversations and push for systemic changes in how we approach race and medicine.
That concludes our talk on the reconsideration of race in medical equations. We hope today's discussion inspires further reflection and action towards equitable healthcare practices.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
I'm thrilled to have all of you join us as we delve into a critical and complex aspect of gastroenterology, the management of Clostridioides difficile, C. diff infection, a topic that has seen significant advances and changes in guidelines over recent years. My aim today is to provide you with a comprehensive understanding of these updates and their implications for clinical practice. We will explore this through the lens of a recent case that presented at our clinic, which highlights the practical applications of these new guidelines. Let's start by discussing the case of Mr. Thomas, a 72-year-old male with a history of diabetes and recurrent urinary tract infections, who presented to the emergency department with severe abdominal pain and diarrhea. His medical history is notable for multiple antibiotic courses over the past year for his urinary tract infections, which immediately raised concerns about C. diff as a potential cause of his symptoms. Upon admission, our first step was to confirm the diagnosis. As per the latest guidelines, which emphasize a two-step testing approach for C. diff, we initiated testing with a sensitive screening test, specifically the glutamate dehydrogenase GDH antigen test, followed by a confirmatory toxin test. This approach is critical because it helps differentiate between colonization and active infection, which is essential for appropriate management. Mr. Thomas's initial GDH test was positive, prompting us to proceed with the toxin assay, which unfortunately also returned positive. This confirmed that his symptoms were due to an active C. diff infection. The next step was to decide on the appropriate treatment regimen based on the severity of his infection and his overall clinical status. The recent guidelines recommend fidaxomicin or vancomycin as first-line treatments for C. diff, moving away from metronidazole due to its lower efficacy and higher rates of adverse effects. Considering Mr. Thomas's severe symptoms and risk factors for recurrence, we opted for fidaxomicin because of its lower recurrence rates compared to vancomycin, as demonstrated in several studies published in prominent journals, including the New England Journal of Medicine. Throughout his treatment, we closely monitored Mr. Thomas for any signs of improvement or complications. His response to fidaxomicin was favorable, with symptoms improving within the first few days of therapy. However, given his history of recurrent infections and the high risk of recurrence associated with C. diff, we discussed the possibility of using adjunctive therapies to prevent future episodes. This brings us to an important aspect of the new guidelines, the use of bezlotoxumab, a monoclonal antibody against C. diff toxin B, which can be used to prevent recurrence in high-risk patients. Given Mr. Thomas's age and comorbid conditions, adding bezlotoxumab to his treatment regimen could potentially lower his risk of another C. diff episode. Furthermore, for patients like Mr. Thomas who experience multiple recurrences, the guidelines recommend considering fecal microbiota transplantation, FMT. This treatment has shown high efficacy in preventing further recurrences by restoring the normal flora of the gut, which is often disrupted in C. diff patients. Managing C. diff infection requires a nuanced approach that considers the severity of the infection, the patient's overall health status, and the potential for recurrence. The updated guidelines provide a framework for making these critical decisions and emphasize the importance of tailoring treatment to each patient's unique circumstances. For healthcare providers, staying informed about these guidelines is essential for improving patient outcomes and managing this challenging condition effectively.